So what can you do about it? That's why you're really here, right? Well, you can start with testing. Now again, the subject of testing could be an entire symposium. So I'm just going to review a few things that are available to you so you know what to ask for or what you might want to test. We're going to talk about genetic susceptibility. We're going to talk about antioxidant status, which you can test for if you want. We're going to talk about testing telomeres, so you could actually see how old you are, not your number, but your cells. And we're going to talk about hormones, hormone testing, briefly. So the first type of testing, looking for single nucleotide polymorphisms or genetic variability. So this is looking for DNA variations in your DNA. And it can affect how you respond to certain medications. It can affect your risk for disease. And these are the SNP tests that are currently available, and they've really come down in price. So these are really available to most people if you want to see if you have a genetic predisposition for a certain disease, which, remember, doesn't necessarily mean you will get the disease. It just means you may have an increased predisposition. Detoxification capacity and drug metabolism. In fact, we're probably not too far away from that being mandatory for certain drugs because we can predict people who will have side effects from medications based on that. Your risk for osteoporosis or heart disease. Nutrient supplementation needs, so we can test for MTHFR deficiency or the ability to make active folic acid, which can increase many different diseases. You can test for genetic predispositions to neurodegenerative disorders, to developmental issues, mood problems, or oxidative stress, and also certain immune problems. And this is a test that is available. Those of you who have a family history of Alzheimer's, whenever my patients say they want to do this test, I always recommend they think it through before testing. So this is looking at the Apo E4 gene. 25 to 30% of us carry the Apo E4 gene. 50% of Alzheimer's patients have at least one copy. Inheriting one copy triples your risk. Inheriting two, 10 times. Some studies show maybe even up to 20 times increased risk of Alzheimer's. And it can also contribute to earlier onset of memory loss. So if you do want to do this testing, because a lot of this now is even available through the internet, you don't even need to ask a doctor for it, just be really mindful of what you're going to do with the information. Because if you carry two of the Apo E4 genes, is it going to help you really take seriously your brain health because you know you're at an increased risk for Alzheimer's, or will you become even more stressed out every time you forget where your keys are? So important to think about that, especially since genetic testing is available through the internet now. You can also do testing to see what your antioxidant status is. Remember how important antioxidants are to prevent oxidative stress or free radical damage, which greatly accelerates aging. And these are some of the antioxidants that we can test for. I rarely do this test in practice because it's a moment in time. I would prefer people take their antioxidants and eat their antioxidants every day. So I rarely do this test, but for some people, they just want to know, and it is available. Third type of testing is looking at telomeres. So remember, telomeres are the caps at the ends of your chromosome, and they prevent the chromosome from fraying or unraveling when the cell replicates. As your cells age, your telomeres shorten. And you can test your telomere levels. There are several labs that do it now. Again, it's come down in price, so very affordable for most people to see, well, how old am I? And sometimes my patients are surprised. They expect that they're going to come back much younger than they are. And sometimes it's the opposite. So it can be very valuable information. And then the fourth type of testing you can do is hormone testing. Now, we can have a debate about whether or not hormone testing is important. I believe it's important, but there are some caveats. First of all, interpretation matters. Body fluid. So now you can do saliva, you can do urine, you can do blood, you can do hair, you can do poop. You can test almost any body fluid for hormones. So the type of testing matters, the interpretation matters. Remember that reference ranges are not necessarily health ranges. So most laboratories report a testosterone of 0 as normal in a woman. And there's a difference between what's called an overt deficiency and a borderline deficiency. An overt deficiency means your levels are really low and you have lots of symptoms. A borderline deficiency means your levels are suboptimal. Suboptimal for you or suboptimal for your age or just suboptimal for youth. And you have some symptoms of deficiency. Optimal levels are likely youthful levels. And each person has their own optimal, which is something to consider. So if you're looking at, for example, testosterone, some women have much higher levels than other women when they were younger. They tended to be driven, athletic, gravitated towards certain professions. When I'm dosing those women, I'm trying to get them back to who they are, not who everybody should be. So that's something to consider too. Some women are higher estrogen women. They feel better at a little higher estrogen level than other women. So testing is your optimal aging blueprint. It gives you some information.